presentation number 10 in GIT series, small intestinal obstruction, prepared by Prof. Sharaf and revised by Prof. Hani Sami. Small bowel obstruction may be due to extrinsic lesions or luminal occlusions, intrinsic bowel wall lesions, but the most common causes are adhesions, hernias, and tumors. Extrinsic lesions include adhesions, which is the most common cause, 70%. Bands and duplication. Hernias are again among the common. Volvulus masses, mesenteric cyst. In the lumen may be bezoar, and this is rare, but it is there. Meconium, intussusception, tumor. Intrinsic bowel lesions include stricture of the bowel, vascular occlusions, vascular strictures, and congenital strictures. The CT findings in small bowel obstruction: dilated loops, collapsed colon, transition point from dilated to non-dilated. If no hernia or tumor at the transition site, assume adhesions as a cause. Small bowel feces sign demonstrates and demarcates the transition point. In the plain film, more than 3 fluid levels in more than 3 dilated lobes of more than 3 centimeters are diagnostic of small intestinal obstruction. Three by 3 by 3. Small intestinal obstruction, small bowel obstruction due to gallstone ileus. Air may be seen in the region of the gallbladder, dilated lobe, and you can demonstrate the stone itself. Complicated small bowel obstruction, closed loop obstruction or strangulation. Strangulation is impairment of the blood supply. Circumferential thickening of the bowel wall on CT with increased density due to blood in the wall and non-enhancement, and finally a target sign. So what are the signs of strangulated obstruction? It is circumferential thickening with increased density of the wall, non-enhancement, and target sign. Here it is, strangulation. We have the whorl sign. It is a rather more exaggeration of the target sign. This is due to twisted small mesenteric vessels. Presence of ascites, presence of adhesions. Of course, this is fluid in between loops. This is fluid in between loops. Fluid in between loops. Pneumatosis means development of air within the wall. All are additional signs. So the original signs are increased density, non-enhancement, target sign, increased density, non-enhancement, target sign. Moreover, whorl sign, development of pneumatosis, the presence of ascites and mesenteric edema, and vascular congestion. Here it is, it's a small bowel obstruction, showing as dilated loops on the left, more than 3 loops, but this one is supine, so there is no fluid levels. And on the right, definitely there is there are dilated loops with multiple fluid levels, and there is whorl sign that is twisting of the mesenteric vessels. Pneumatosis, that is development of air within the wall, and this may be associated with portal venous gas. This is a dangerous sign. Here, the small bowel fecal signs, that is development of air within the contents of the small bowel due to delay and stasis. It's called fecal or feces sign. This sign is usually seen only in the colon. Collapsed distal loop and dilated small bowel loop are if you are successful to show it this with diagnostic tools, because you are showing now the transit area between abnormal and normal. Dilated loop, tortuous with fluid level. The cause here in this case is inguinal hernia. See, the loop is directed here towards the hernial site, and this is the part of the loop outside the anterior abdominal wall, and this is a intestinal obstructions due to hernia. Closed loop obstruction, we talked about the strangulation. Now closed loop obstruction can be occur in those with afferent and efferent loops if there is a post-operative change. When obstructed, they show fluid-filled distended loops with U-shaped configuration. There is radial distribution in cross-section, and stretching and thickening of the mesenteric vessels. These are the findings of closed loop. Here it is. Vascular venous congestion is like that. Dilated small bowel loops in closed loop obstruction. This is a closed loop here, this area. And there are some congestion in the mesenteric vessels as well. And there is radial distribution. They are arranged either in two lines or in two opposing places. And here is closed loop obstruction demonstrating findings of strangulation. In findings of the strangulation, we have the development ascites, development of mesenteric edema, dilated loops of obstruction, and these dilated loops is proved to be in a closed loop obstruction. Thank you.